Neurofunctional acupuncture is a subcategory of acupuncture that works through the neuromodulation of the nervous system. Uh, when used in conjunction with motor point stimulus, it can create a systemic uh, healing effect as well as a local perfusion that are very effective together in the treatment of musculoskeletal disorders in patients. Um, I'm just going to explain a little bit about one of the mechanisms through which this works. By needling peripherally, locally, and axially near the spinal cord, we can address all three levels of neuromodulation: the peripheral, axial, and supraspinal, the central nervous system above the spinal cord. Um, so the neuromodulation begins with a stimulus. So the stimulus is, in this case, is the insertion of a needle, and then continued stimulation of that needle either manually or through electric stimulation. Uh, when you first insert a needle, there is a generation of a nerve impulse. So that nerve impulse travels along the neural fibers. This is the A delta fibers and the C afferent peripheral nerve fibers. By inserting the needles locally and actually, we can occupy those fibers along the pathway of the nerve. So it then has an inhibitory or blocking effect on the signals coming from the area of pain to the spinal cord and reduces the patient's perception of pain, and as well as creating a local reaction of tissue moderators, with release of substance P, calcitonin, gene-related peptide, adenosine, opioids, etc. Which have a local vasodilatory effect, and then as the inflammation starts to occur, then that triggers the anti-inflammatory reflex response, which then causes an actual anti-inflammatory response in the local area, which is generally larger than the inflammation reaction caused by the needle itself. So through an anti-inflammatory response as well as the release of these opioids and endorphins, we cause the systemic relaxation or local relaxation, and then through the central nervous system, you have the release of other neurotransmitters such as serotonin, dopamine, norepinephrine, and as well as endorphins and adrenocorticotropic hormone, which together have an engaging effect on the parasympathetic nervous system and a relaxing effect on the body. So the patient can end up having a euphoric effect and relaxation throughout the nervous system, as well as by activating the nervous system, you are occupying the descending efferent signal pathways, which also reduces the efficacy of the body's reaction to the pain signals themselves. So it reduces the stress the stress response caused by the pain signals, and then in combination with this systemic calming effect and anti-inflammatory effect locally, we have the motor point stimulation. The motor point is the point at which a muscle is innervated. So by stimulating it, you can cause the muscle to contract. And when we contract the muscle, we squeeze out all the old blood and interstitial fluid in the area. And as it relaxes, all the new arterial blood full of oxygen and proteins and nutrients for the cells in the area floods into the area, and then as it squeezes again, that nutrient-rich blood is then pushed further into the local tissues, and so it contracts and relaxes and contracts and relaxes, and the used blood gets pushed back into the venous system, into the lymphatic system, and back to be cleaned, and then it's new blood and new nutrients are all brought in for the benefit of the local cells and tissues. Which facilitates healing at a much faster rate. So by combining the relaxation of the body systemically with the perfusion of the body locally, you can have a very powerful effect on musculoskeletal disorders in your patients. Thank you.